Hi guys, a few years ago when Therese Coffey was the head of the DWP, she was asked a number of times in an interview what she felt when she was told that a woman had been found dead next to her child. She had been living in extreme poverty. Kay Burley had explained the case to her and Coffey refused to show any empathy whatsoever. So fast forward to today where the current business secretary with Equality Brief, Kemi Badenoch, was asked what her government is going to do about people who are literally dying in hospital corridors because they can't get treatment. Badenoch waffled and finally ended with, well, we're proud of our record.
Let me ask you about the Royal College of Nursing. They have put out a note today to say that there is a crisis in the National Health Service and people are having to be treated in corridors because there is nowhere else to treat them. Intimate examinations, sometimes people are actually dying in corridors. They say their staff are regularly forced to care for patients in that way. What do you make of that?
Well, I think that is appalling. I do know that this is something that the government has been working on. We've put more money into the NHS than ever before. We do understand that there are difficulties in certain hospitals. This is not the case, certainly in my constituency, for example.
How do you know that? If the Royal College of Nurses report just came out today, how can you claim that, well, it's not happening in my constituency? She's obviously lying here. She hasn't seen the report. Like, if she was the health secretary, then perhaps she could have a leg to stand on. But she's just gaslighting the public here, lying, saying, oh, well, there's nothing wrong with my constituency. Have you seen the report? No, but believe me.
But this is one of the areas where we have been talking about ensuring that the NHS is delivering more for people, given how much that we have been putting into it. Of course, the scenario that the Royal College of Nursing describing is not something that we ever want to see. We know that there will be specific issues in some areas. And I know that the Health Secretary has been out just yesterday, in fact, talking about what our plans in this space will be.
OK, tell me a bit more about your plans.
About
the plans for the NHS and how you're going to make sure that people are not treated in corridors.
Well, one of the things that we're trying to do is actually make sure that we get staff back to work. We have a pledge about bringing down waiting lists. That is something that was coming down until the strikes. We've been talking about getting a settlement. We have started a programme for building new hospitals. So we do have a plan.
A plan? We have a plan. Now, of course, she's lying when she says we're bringing down the waiting list. The waiting list is at record levels since 2010. You can't say, and you can't blame the pandemic here. It was rising before the pandemic. But her message to somebody who's sitting in a corridor at this moment, somebody who's dying in a corridor in a hospital, is, don't worry, we have a plan for the future. And we will implement that plan, well, we might, if we get re-elected. So you may be dying, but after the 4th of July, when we get elected, we will think about implementing a plan. We've had 14 years to implement a plan to reduce the waiting list, to improve the NHS. But no. It's actually going to be implemented after the general election. So if you survive, if you're lucky enough to survive while sitting in that corridor, there's a chance that we will implement a plan.
For the NHS. Of course, there will always be issues from time to time. There's never been a time when there haven't been issues with the NHS. But people have been saying for multiple decades about how we wanted to privatise the NHS, how we didn't care about it. And yet all we have seen is more and more investment in the NHS under the Conservatives. I've been an MP.
I really wish, I don't know if Kay Burley will ever hear any commentary I've added to her videos, but I really wish Kay Burley or somebody would ask the simple question, is it enough? Ask a minister. When they say, we've invested 20 billion, 100 billion, whatever billion into the NHS, ask the simple question, is it enough? In your opinion, is it enough? Because if they respond by saying, yes, it is enough, then there shouldn't be any problems. If they say, no, it isn't, then of course the follow-up question would be, why haven't you invested enough? It's a very simple question. And it would really drive home the reality that these politicians don't give a crap about the NHS. Waffling on about privatization. The problem is that you haven't invested sufficient resources in the NHS and you have allowed so much of it, whatever does go in, into the private sector. which is decimating the NHS.
At a time when we put in £20 billion more, we fulfilled manifesto obligations in terms of funding the NHS, and I think that is a record which we can be proud of this morning and throughout this election.
Okay.
So her message to people who are literally dying in corridors in NHS hospitals is, we're proud of our record. There you have it. This isn't all that different to that interview with Therese Coffey where she ignored the fact that somebody had died because they couldn't access benefits. How is this any different? People are literally dying. People are suffering at the moment in corridors because they can't get the treatment they need. And the response from the Tory minister, not the Minister for Health, but a Tory minister, is, we're proud of our record. Because there's an election coming up in a few weeks, so we're not going to say we've actually messed everything up. We haven't invested enough money in the NHS. We've actually run it into the ground. We better not say that, because that would be the reality of the situation, and then people will not vote for us. So to hell with people in corridors literally dying, because there's a bigger goal here. There's something much more important. What's more important is I get back into my seat in Westminster. Absolutely disgraceful.